I'm Dr. Mary Gingrass, and I'm here to try to answer some of your most frequently asked questions about breast implants. Today we're going to talk about silicone versus saline. How do you decide? Silicone and saline have three main differences, and I'm just going to talk about sort of the down and dirty. Saline are a little less expensive than silicone. At our office, we don't make any money on breast implants either way. We just pass them on to you at the cost from the manufacturer. And it can be as much as $1,000 different. The second difference is what happens when an implant ruptures. A saline implant is filled with saline solution, and it's just going to go flat. Like, you're going to have a flat tire. You're going to call us up and say, please get me on the schedule. I need an implant exchange. The silicone does not go flat. The silicone, generally speaking, just gets a little sticky. You don't necessarily know if your silicone implant has ruptured. So most of the time, a silicone rupture gets picked up like on a mammogram or some other x-ray that you happen to have. Or if something changes and you come in to visit, we can help you decide whether it needs to have any workup. The third difference is how they feel, and that's probably the biggest thing. The saline implant feels a little more watery because it's a bag of salt water. So it feels a little more watery than the silicone implant, which tends to feel a little bit more like breast tissue. And that's neither really good or bad. The saline implant in a thin person, you're going to feel it a little more, you're going to feel the edges a little more than in a silicone. So do they look any different? In the majority of patients with sort of normal bodies, women's bodies, they really don't look that much different. I would say 90% of the time when I open someone's gown and I haven't looked at the chart, I don't know if they have silicone or saline. I can't really tell until I feel the breast or try to feel the edge of the implant. So they do feel a little bit different, but they don't, in most cases, look that different. So you just kind of have to decide what things are most important to you, and I recommend talking this over with your surgeon.